I am Heather Didrick. I am partners with Heather Grant. I am presenter number 2, and we are presenting on telemedicine and telehealth. Just wanting to go over telemedicine a little bit, which is the practice of caring for patients remotely when a provider and patient can't meet physically via a video conference tool. These visits are for specific clinic services, such as digital transmission of medical imaging, remote medical diagnoses, evaluation of medical consults with specialists. The difference between telemedicine and telehealth. Telemedicine is very specific in the services that it provides, whereas telehealth refers to a broader scope of services. Telemedicine has 3 different types: store and forward, remote monitoring, real-time interactive services. Store and forward does medical images, biosignals sent to specialists as needed when acquired from a patient. So, such as dermatology, radiology, and pathology are 3 common specialties that handle that. There's remote monitoring, also known as self-monitoring or self-testing. They use a range of technological devices to monitor health and clinical signs of a patient remotely, such as some diseases that this would be used for is asthma, diabetes, and other chronic diseases. For example, like a pacemaker or defibrillator, those can be monitored remotely and help with that patient care. And then there's real-time interactive services. This provides immediate medical attention online, over the phone, and some home visits. And this can be very similar to a face-to-face appointment. A little history of telemedicine. I found this very interesting when I was looking into it. Telemedicine actually began about 50 years ago, and it rapidly progressed very quickly as technology rapidly progressed. In the 50s, medical staff in Pennsylvania transmitted radiological images via telephone is when how it first came about. By 1959, University of Nebraska doctors were transmitting neurological exams across their campus via two-way TV. And then in the 1960s is when the government got involved into telemedicine. And then by 1964, University of Nebraska doctors built a telemedicine link, which gave them a way to provide services 112 miles away to provide services off campus to some of the specialties that adopted to telemedicine and telehealth very early on were radiologists, obviously, psychiatry, dermatology, ophthalmology, nephrology, oncology, pathology, and rehabilitation were some of the specialties that jumped on board to telehealth and telemedicine very early on into the oncoming telehealth and telemedicine. And who is using telehealth and telemedicine? Emergency room docs, 38.8% of them use this service, whether it be with talking with other specialists, consulting with them, reaching out to even other emergency room docs, that type of thing. Pathologists at 30.4%, radiologists at 25.5%, allergists at 6.1%, and gastroenterologists at 7.9%. One question that I was really wanting to know was what can be treated via telemedicine and telehealth? Like, what can I even set up an appointment for and be seen for? I was actually kind of shocked about all the things that you can be seen for. We have allergies, arthritic pain, asthma, bronchitis, colds and flu, diarrhea, infections, insect bites, prevention and wellness services, even post-op check-ins, pharyngitis, conjunctivitis, rashes, respiratory infections, sinusitis, skin inflammation, cellulitis, sports injuries, vomiting, UTIs, bladder infections, sprains and strains, sore throats, birth control counseling, lab results, lower back pain, even otis media. All of those you can set up visits for telemedicine and telehealth and can be seen for. So quite a few services there. And just a tidbit of information in regards to billing. Medicare, good old Medicare and all their tricky things, only allows these visits in shortage areas of health professionals. So for your rural areas, your small towns and communities, only allows telehealth and telemedicine for physicians and practitioners, hospitals, critical access hospitals, CAH or renal dialysis centers, skilled nursing facilities, and community mental health facilities. Medicare only allows those facilities or those professionals to use telehealth or telemedicine with their patients. Medicare only reimburses for real-time secure video chat for telemedicine. So the other two options, they do not offer those services or pay for those services. Those would be a non-covered services for the patient. They only cover certain CPT codes, and those codes can and will change yearly as well through Medicare. As for Medicaid, all that will depend on the state regulations, as each state regulates their own Medicaid, so that you would have to check which that each state's policy and program. And just some individual helpful information. When billing telehealth or telemedicine services, you always want to use the modifier GT to call out those services. Prescribing medication is allowed as long as a pre-existing relationship between the physician and patient occurs, as well as the e-visit can be submitted as in place of the exam. So if there's already a relationship between patient and physician, and the e-visit can be replaced instead of a physical exam, then they can write a prescription for that visit, for those services. And a telehealth or telemedicine visit should not be used when an in-person exam is required because of the severe symptoms or procedures or aggressive interventions that need to be done. All right, and that is all I have